Okay. All righty, cool. We got the recording started. So this is our 5th webinar in the SHIP SMP volunteer webinar update series. So many of you have attended all 5 webinars, and we can't thank you enough for wanting to connect with us and get all this update training. This month we are going to focus on Medicare supplemental plans, or Medigap policies, which is only for original Medicare. So if someone wants to purchase a Medicare supplemental plan, they have to use their red, white, and blue Medicare card as their primary insurance card. If they have a Medicare Advantage plan, it is illegal to purchase this. So we're going to talk more about that in the future as well. But I want to make sure everyone knows that Medicare supplemental plans are specifically for original Medicare. Ooh. Yay, okay. So everyone knows this is one of my favorite charts to look at. We're on the second slide for those of you who aren't able to be on the webinar. I'll try and remember to tell you what slide we're on. If not, I apologize. But this is your Medicare options slide. So whenever you think about Medicare, think about a fork in the road. You have to decide which path you want to take. The first path is going to be your original Medicare side. That's what we're going to focus on today. You have your red, white, and blue card. You have your Medicare Part A for your hospital insurance, Medicare Part B for your medical insurance, standalone prescription drug plan for your Part D, and then what we're going to focus on mainly today, you can choose to enroll into a Medicare supplemental plan. So why is a Medicare supplemental plan important is because it covers the 20% that Medicare does not pay. So original Medicare is generally speaking, now there's little nuances here and there, but generally speaking, original Medicare is an 80-20 split, meaning Medicare pays 80% and you are responsible for 20%. So the supplemental plan covers that 20% Medicare doesn't pay. Original Medicare is also nationwide. So that supplemental plan, no matter what state you get it in, so all beneficiaries who are residents of the state of Tennessee will get a Tennessee supplemental plan that will travel with them across the country as they travel, just like their Medicare. Any questions on original Medicare? Excellent. So I really want you to understand that we're focusing on this side of the spectrum. Our other side, the Medicare Advantage plan, is quite the opposite. It has networks of providers that you have to go to, so it's not nationwide. And instead of the 80-20 split, the Medicare Advantage plan, you have co-payments, set co-payments per plan that you enroll into. So it may be $10 to see your primary care doctor, $30 to see a specialist, $300 for days 1 through 5 in the hospital, something along those lines, so you know what the cost of your health care is going to be. Now, the big thing, the main reason I wanted to show you this chart is this, the bottom section of the Medicare Advantage plan side says you cannot be sold a Medigap policy. So remember, if you're in an Advantage plan, you cannot be sold the program that we're about to talk about today. The most common misconception we have with many of our Medicare beneficiaries is they think that their Medicare Advantage plan is a Medicare supplemental plan, and that is simply not the case. They are completely opposite. We get a lot of confusing terminology when it comes to talking with Medicare beneficiaries. Okay, questions on this chart? All right, moving right along. So we have a lot of costs associated with Medicare. So I wanted to go run through these really briefly because Medicare supplemental plan covers the gaps in Medicare, meaning many of these deductibles and co-payments and co-insurances could potentially be covered by your supplemental plan. So our first one is our Medicare Part A deductible, or your hospital deductible, $1,316. Now do me a favor, and I really want everyone to know this. Do me a favor and do not, I know it's crazy, right? Do not memorize these numbers. We have plenty of tip sheets and handouts that you can use to where you don't have to memorize numbers and you have quick reference tools. Because I know I tried to memorize numbers and I have dyslexia and I gave out a lot of misinformation. So refer back to this, or if you need additional tip sheets, let me know and I can send you some updated information. Speaking of hospital stays, days 61 through 90 is a $329 per day copay. Days 91 through 150 are $658 per day copay. All of those things could be covered under your supplemental plan. Skilled nursing facility care. Again, this is short-term intermediate rehab. This is not a long-term care service. For days 21 through 100 in skilled nursing, it's $164.50 per day for days 21 through 100. Medicare can get expensive, can't it? Oof. Hospice care, if you use inpatient respite care, a big example of this in the Nashville area is Alive Hospice, where you're actually an inpatient in a hospice care facility. You could have a 5% coinsurance. Okay, going to go on to the next slide. Part B costs. You have a $183 Medicare Part B deductible. Again, Part B covers your medical insurance. And then after your deductible, you have a 20% coinsurance. So everything we're talking about so far may be covered under your Medicare supplemental plan. One thing that is not going to be covered under a supplemental plan is your Part B premium. You still have to pay that Part B premium if you want a Medicare supplement plan. In 2017, the Medicare Part B premium is $134. For new beneficiaries in 2017. If the slides do say 2016, I apologize, I didn't update the year. These are all 2017 costs. I stole the CMS, our Centers for Medicare and Medicaid Services slides, and I forgot to change the year. But I promise these are all 2017 numbers, despite what the slide says. Good call, Alice. So 2017 premium is $134. People who were on Medicare prior to 2017 are going to have a lower premium. And we actually talked about this 2 months ago, so I'm not going to recap too much on that because I really want you to focus on this year. And 2017's premium is at $134. Anyone prior to 2017, honestly, we're not going to know for sure what their premium is. They have to contact Social Security or look at their Social Security .gov account and see how much is being taken out of their check, because it's going to range a lot of numbers for people who were prior to 2017's enrollment. Next slide. You have to have Medicare Parts A and Part B to get a Medigap policy. You can't have one or the other. You have to have both. And you have to pay that monthly premium for that policy as well in order to keep it. And again, like we talked about, you have to pay that Medicare Part B premium as well. What I really enjoy, and we're on the standardized plans now for those of you who can't be on the webinar, my favorite thing about our Medigap policies or Medicare supplemental plans in Tennessee is that they are all standardized, meaning no matter what company you go with, whatever plan you choose has to give you the same benefits, the same basic benefits, I should say. And we're going to look at a chart about those basic benefits here in a minute. But in Tennessee, we have plans A, B, C, D, F, G, K, L, M, and N that are available currently. You can see we're missing a few letters, meaning those plans no longer exist. Well, they could exist, sorry. Those plans are still around but are no longer being sold. So E, H, I, and J. You might see those letters float around here and there, but no one can purchase them anymore. The only states that have an exception to the standardized rule is Massachusetts, Minnesota, and Wisconsin. They have different plans and different structures than the rest of the country. And honestly, I don't know all that much about their structure of supplemental plans, but I can do some research if anyone's curious on that. But honestly, I don't live in Massachusetts, Minnesota, or Wisconsin, so I only do the research. I don't want to memorize any of that stuff. All righty. The biggest difference with the supplemental plans is the premium that the company is going to charge you. Again, your benefits are all the same depending on what plan you choose. But the premium that that company you enroll with is going to charge you is going to be the biggest difference. So speaking of our charts, here it is. And I'm going to move this around so you can see it. So here are all of our letters. Not only do we have parts A, B, C, and D, now we're going to talk about plans A, B, C, and D. No one's confused, right? We can understand more and more as we talk about Medicare how our beneficiaries get so confused so easily when it comes to Medicare. So before we talk about the plan structure, let's talk about the benefits that are covered under a supplemental plan. You have your hospital coverage. And look at this. It covers up to an additional 365 days after Medicare benefits are used. You get an extra year in the hospital that your supplemental plan is going to pay all the cost for. That's pretty awesome. And look, that's covered 100% no matter what letter you enroll into. Medicare Part B coinsurance or copayment, that's the 20%. Blood, if you're ever charged for blood. Hospice care, coinsurance or copayment. Skilled nursing care, your Part A deductible, the $1,316. I tell you not to memorize that. I've memorized it. That's because I talk about it all the time. Your Part B deductible is $183. Part B excess charge. Does anyone know what an excess charge is?
Yes.
I like audience participation.
That's what a doctor can charge if he is not contracted with Medicare. He can charge more than the Medicare approved amount, like
Excellent.
15%.
Do you know what that is? That Pat?
No, it's Nancy.
Nancy, sorry, Nancy. You and Pat don't like.
Okay.
Nancy, do you know what the percentage is?
I believe it's 15% more.
Excellent, gold star. So an excess charge is, as Nancy said, when a doctor who is not contracted with Medicare can charge the beneficiary up to 15%, 15% more for that service. It also happens if the doctor wants to perform a service or procedure that Medicare does not cover. They could charge that extra 15%. And the last but not least is foreign emergency travel. Now, I really want to stress that the word emergency in Medicare language means threat to life or limb. So it has to be considered an emergency. Routine blood work in Spain is not going to count as an emergency. Thank you for the chuckles. I appreciate it. All righty. So what do our plans look like? So Plan F as in Frank is kind of our Cadillac. It covers everything at 100% with the exception of foreign emergency travel. So that means you will have no out-of-pocket expense. Of course, the more things that are covered, the higher your premium is going to be. So our next most comprehensive plan, debatable depending on which way you look at it, could be Plan G as in girl or Plan C as in cat. So Plan G as in girl covers everything except for the Medicare Part B as in boy deductible, which is $183. Plan C as in cat covers everything except for that Part B excess charge that Nancy and I were talking about. And just so I can clarify on the excess charge as well, it's pretty rare. In the almost 7 years I've worked with the program, I've only had 2 clients be charged an excess charge. So it's not something you're going to come across on a regular basis necessarily. And another most comprehensive plan is D as in dog. That covers everything except for the Part B deductible and the Part B excess charge. Generally speaking, and when I say generally speaking, I'm talking about my personal experience, most of my clients have C, D, F, or G plans. because they are the most comprehensive. Mary, it looks like you have a question. Go ahead.
This is Sarah, Mary. Yeah,
Sarah, sorry.
That's okay. They follow you no matter what state you're in, correct? Like if you're visiting another state and you have, a plan in Tennessee, but you're in Michigan, you need to go to the doctor. If they take the original Medicare, the doctor has to take your supplement, correct, even if it's from a different state?
Yes, absolutely. The supplemental plans go with you as long as the doctor accepts original Medicare.
Thank you.
Good question. Great question.
Can I ask a question? It's Allison. I'm not on the webinar. I'm getting all my terms confused.
Okay.
Medicare Part B, coinsurance or copayment, is that that $183 you pay per month?
No, that's the Part B deductible, and that's only one time annually.
Okay, so that stays. None of these pay. No, 2 of C and F pay for that.
Yes, and we're going to talk a little bit more about C and F here in a minute. For those of you who are like, don't forget to mention C and F, I will be talking about that next.
Thanks. Where it says Medicare Part B coinsurance or copayment, that should be your 20%.
Yes. Yeah,
and then the one that says part down towards the bottom where it says Part B deductible, that's for this year 183, 166 last year. That's your annual Part B deductible. But that second line, the Medicare Part B coinsurance, that's your 20%.
Absolutely. Thank you, Nancy. So you can see we have other plans as well. A covers the least, B covers a little bit more. K, L, M, and N, you can see doesn't cover 100% on everything. They cover 50 to 75% on something. So a lot of things for the beneficiaries to choose from. We can't tell them Plan F is the best or Plan G is the best. We give them the chart, explain the chart to them, and at the end of the presentation, I'm actually going to go walk through a tutorial of our supplemental plan comparison tool. So whatever plan they want you to look at, you can actually give them a premium estimate of what they might be charged for whatever plan they're interested in. We're going to have fun today. Sharon, you have a question. I think. You raised your hand anyway. Maybe you did it on accident. If you're doing it in the chat, I can't see the chat, so you have to talk. Sorry.
Oh, no, I don't have.
I didn't see physical therapy on this.
Well, the Part B coinsurance, that kind of lumps everything in. So anything that's covered by Medicare Part B is going to be and is accepted by original Medicare is going to be covered. So it doesn't break it down by specific, open heart surgery, transplants, physical therapy, any of those kind of things. Anything covered under Medicare Part B is going to be covered under that Part B coinsurance or copay.
Thank you.
No problem.
Sydney.
Yes.
This is Sharon. I was still on mute, just talking away. Okay, this has happened a couple of times for new beneficiaries purchasing a Medigap plan for the first time. They have been instructed by the agent to not purchase a Plan F because the fear is that since it's going away, that the companies will raise the prices on those plans because they won't be available anymore, that they need to go with a C or a G.
That is an excellent segue into, did I not put it in here? Come on now. Oh, I did not add it into this presentation. Darn it. Okay. So let me talk about Sharon's point because I thought it was going to be the next slide, and it's not. So Sharon is absolutely correct in that Plan C is in cat and F is in Frank. Starting January 1st, 2020, will no longer be sold. So I apologize, this is not on your slides. If you're on the webinar or if you're looking at the print-off, this is additional information that you may want to take notes on. So I apologize. I will send out an updated PowerPoint presentation with this information in it. Making myself a note. Okay. So Plan C is in Cat and F is in Frank are no longer going to be sold January 1st, 2020. It's very similar to what we talked about earlier with Plan E, I, H, and J. They still exist, but they're no longer sold. Starting in 2020, Plan C and Plan F are going to be added to that list. So it is a concern. It's not a guarantee because we haven't been told anything, but it is a concern that if you enroll into Plan C as in Cat or F as in Frank, and you stay in that plan after January 1st, 2020, you could see a higher rate of premium increase because no additional people are paying into the benefit. So let's say all of us who are on the webinar today are on Plan C or Plan F, doesn't matter which one. Generally speaking, as we get older, we're not getting any healthier. So we don't have the healthy people paying into the pot to help pay for us as we get older and sicker. So who's going to pay for us sick folks? Well, all of us. So the way to pay for the sicker people is to pay a higher premium, perhaps. Again, not guaranteed. Theoretically, we can see that it's possible. I can tell you that people who are enrolled, some people, not all, there's exceptions to every rule, of course. Some people that I've talked to who have plans E, I, H, or J, the plans that are no longer sold, have seen a higher increase in their premiums. Most, not all, but most of them have. So history could repeat itself in that way. And I believe I saw Alice have her hand up. Alice, do you have a question?
I do. I suppose it would be too much to hope that it would be a guaranteed special enrollment period with a guaranteed enrollment so most people could change without health criteria to another plan in 2020? Probably not.
Well, we have not gotten official word from CMS, Centers for Medicare and Medicaid Services, that there will be a guaranteed issue right for those people who are currently enrolled in Plan C or Plan F to have a time frame that they can disenroll from Plan C or Plan F and get a plan that's going to be sold with no medical underwriting. We haven't been told if that's an option or not.
Sydney, this is Nancy.
Yes.
I had a case recently. I was talking to the beneficiary. She had a Plan J, and she had gotten a notice from the insurer that her premium was going up. She called them, and they allowed her to switch into one of their other plans. Now, they actually put her in an F plan, which my brain went, well, I don't know if that was a good idea, but okay. So they did allow her, since that premium was going up on that plan, she already had one of their plans. They allowed her to switch into one of their other plans. Now, whether they'll do that this time around, again, that's future. 3 years down the road, who knows? But I suspect they may do that if they stay with the same company and the plan they have goes away, that company may allow them to look at the other plans that they sell, but no guarantees.
Right. It is a higher possibility or probability. I can't remember which verbiage to use. It's a higher chance that you can switch a plan within the same parent company. So in Nancy's scenario, let's say the lady was on Plan J and Blue Cross Blue Shield. Blue Cross Blue Shield may be a little more flexible to let her enroll into another plan that Blue Cross Blue Shield sells. Now, if she's on Blue Cross Blue Shield and wanted to go outside and, say, enroll into United Healthcare, that may not be as easy. So it's possible. It probably is going to mainly depend on the insurance company if CMS, Centers for Medicare and Medicaid Services, don't issue a guaranteed issue right. And for those of you on the call who are like, what is this guaranteed issue right thing she keeps talking about, we're going to talk about it here in a little bit. So I promise everything that we're talking about, we're going to reiterate throughout the presentation. At least I hope.
Sydney,
I thought I had another slide. Yes.
This is Sharon again. Sorry.
That's okay.
Right now, what are the guidelines, or are there guidelines for how much a Medigap plan can increase year over year?
Right now, there are no guidelines that I am aware of. All Medicare supplemental plans have to submit their increases to the Tennessee Department of Commerce and Insurance, and they have to approve the increases before they can be issued. So to my knowledge, there's no cap.
All right. So are there guidelines on when you can change?
We are going to talk about those, yes.
Okay. All right. Then. Okay. So I guess my question is, and maybe I've certainly had to change because I'm always, the most you can have is A, B, D, and F. And so I've backed up. But people 6 months ago that got an F, should I get them to try to change plans now?
You can
while
tell
they're
them,
still new?
Well, it's one of those things that we can't tell them to do something. It's one of those things where as SHIP staff and volunteers, we can say, hey, I see that you enrolled into Plan F. I'm not sure if anyone told you when you enrolled into that Plan F that it's going to be going away in 2020, and with it going away, you may see a higher increase in the future. And if that concerns them, we can do a comparison to see if they're able to switch to a different plan. But it's not something that we need to send all of our clients in a panic saying, oh, my gosh, you have to change right away. It's just one of those things that it's a bit more education than anything else, and having that beneficiary decide.
Yeah, but the problem is there's just too many unknowns.
Exactly. That's another big thing. And
any idea when they might have some guidelines on this?
We have, as SHIP staff, we go to a regional conference every year, and they still haven't told us the dates or locations yet. But when we know, that's definitely one of the questions that I'm going to bring up, is if those people have a guaranteed issue right. And let me tell you, they love when I ask them questions.
Good.
So
I'll send you a list I've got.
This is Nancy. When I do a comparison with people, and if we're looking at F, and usually that's probably where I'm going to start, but I make it very clear to them that the F and the C plan are going away. And what is going to happen after 2020, I got no clue. I don't know. So if you decide to go with that plan, just know there may be some changes coming up in the future. I don't push them one way or the other. I just say it is available today. It will be discontinued in 2020, and what happens at that point in time, I can't answer that question. And then they're the ones that are going to have to make the decision. And I have had several that have gone with Plan F. Again, they want that deductible picked up, which, okay, but I'm thinking it's going away anyway, but that's their choice. So I just make sure they're educated that those two plans are going away, and if that's what they choose, I explain a little about we can't tell you what's going to happen then, but you may see a more sizable increase in premium, and let them decide what's going to work for them. And I have one other question, and really the thing that brought this to my mind was I got advertising in the mail. Some of the plans, the one that comes to mind, because what I got was Blue Cross Blue Shield. The basic benefits, as they are here, are the same across plans. However, some of them may provide additional benefits, such as silver sneakers or something like that, some other little perks. Is there anywhere that we can go to get any of that information as to what those perks might be?
Unfortunately, no, because it's so individualized by insurance company. So we haven't gotten a list of the extra perks. Yeah. It does happen sometimes.
Sydney, I think she's mixing Advantage plans with.
No. This is Blue Cross Elite. It was a supplemental plan.
Yeah.
Yeah, Nancy is correct. There are supplemental plans. It does sound like an Advantage plan. And I think actually when Nancy first told me about it, I actually questioned her as well, I think.
Yeah.
Because I didn't want to believe it. No. But I did some further research after Nancy brought it to my attention, and Blue Cross Blue Shield offers some additional things, and I believe Humana is another one that offers some additional benefits. but it's still considered a standardized plan.
This is Allison. I have a question I haven't done. I'm a newbie. In Tennessee, all this Blue Cross Blue Shield, Humana, everybody else, if somebody says, well, I want to get a Plan D, are they different prices for the same coverage?
Plan D drug plans are different
Plan
plans.
No, Plan G, Plan anything,
I'm
these
sorry.
plans.
Any of these plans in Tennessee, they have to give you what's on this chart.
Right.
So G has to cover all of that. That's the standardized part. But some can offer additional benefits on top of the standardization. But as long as they have those standard coverage, it's considered.
So the standard coverage, does that, the ones that don't, I guess what I'm trying to say is can somebody wants to get a G, and if they don't offer any extra ones, would they be the same price no matter what insurance company it is?
No, the prices vary greatly by insurance company.
She'll go into that when she does the tool.
Okay, thank you.
We'll see that.
Thank
Sydney?
You. Yes,
this is Sweet Pea. I need to ask you a question. This is a situation that I have. I have a little lady that really can't afford her F plan anymore, but she now has diabetes, and I told her, I said, I don't, then I'm afraid that if she attempts to drop down, they're going to use the fact that she now has developed diabetes, and then she won't have coverage at all.
That's possible.
Have her go back to whatever company she has her current plan for and ask them, do you have any other supplemental plans? And look at it that way.
I was going to suggest that as well. Whoever she has her S through, see if she can drop coverage within the same parent company.
Because, see, I don't see them offering her anything, because she now has diabetes.
Yeah, Sydney.
Right, and the medical underwriting really hits home when you try and change parent companies. They may be a little flexible within the same parent company. So I would have her call and just check. It may not be an option, but it's something to look into.
Yeah.
And I believe Carol Samuels, you had your hand raised, so we'll get Carol Samuels' question next.
Hi. Quick question. Part B deductible is going away when? Is that going away and when?
The Part B deductible is not going away, but the two plans, the C and the S plan that pay for the Part B deductible are going away.
Okay, but is it going to be reduced or is it going to go up?
We won't know that until probably late October, early November for 2018.
My opinion would be, and my rationale that why I think they're doing, and just my talking to people are not prepared. They don't understand Medicare. What do you mean I have to pay a premium for Part B? They don't understand the deductible, and I think what the focus is to make people have got to start being responsibility for their own care, for what they want. They've got to understand what the costs of health care are. And I'll tell you, I get scared because I'm thinking, these people coming up, they have no clue. I've been around too long.
I'm one of them already. But I just wanted to make sure, because a previous caller said when the deductible is going to go away, and I thought, I didn't hear that, so I wanted to make sure.
No, the coverage for the deductible is going away. Everybody, bottom line, everybody that is on original Medicare will have to pay the Part B deductible, whatever it is. I would guess next year it's probably going to be about a couple $100. That's just pulling figures out of the air. That is just, it was $166 last year, it's $183 this year. And once 2020 rolls around, there will not be a plan that will pick up whatever the Part B deductible. I don't care if it's $500. Everybody will have to pay the Part B deductible in full themselves. They've got to be prepared.
I just wanted to make sure.
Yeah. Scary.
So I just wanted to make sure I understood right, because the previous caller had said Part B deductibles going away down the road. And I went, I never heard that.
No, the coverage is going away, but not the deductible.
Right.
Hello,
right.
this is Shannon, and I want to clarify. If you have a plan C or F and you wish to keep it and pay the higher premium, it will continue to cover everything it says it will cover now, just like the F plan does and all the rest of those that have gone away. We understand?
Yes, absolutely. And that's another point I was going to make after the question, was after 2020, if you decide to keep your Plan C and keep your Plan F, the Part B deductible will continue to be paid for you because the coverage is not changing. The only way your coverage is going to change is if you change your plan. So if I'm on Plan F and it's July 2025, I have the exact same coverage that I have today. Does that clarify your question? Excellent. So this is great discussion. I'm going to move along in the presentation because we have a few more things to cover before we get to the tutorial. So what determines, your Medigap cost? Age is a big factor. If you're under 65, your premium is going to be 3 to 4 times higher than someone over 65, and we're going to get into that a little bit more. Also, where you live, meaning your zip code. Generally, I've seen more urban areas have lower premiums because it's more populated, and rural areas may have higher premiums because they're less populated. The company selling the policy is the biggest factor overall. I have the example I always use is if you're looking at a Plan F, Blue Cross Blue Shield says I'll sell you a Plan F for $150. Mutual of Omaha says I'll sell you a Plan F for $100. Which plan do you want to choose? Same exact coverage. What premium do you want to pay? There are some discounts. Ladies, we get a discount on our insurance because they say we no longer can have babies. So our premiums are lower than men's premiums. Another reason for that, women statistically live longer than men. So they're going to have women's premiums be less and men's premiums be more expensive. Non-smokers get a discount. Also, married couples may be able to utilize a household discount. And we'll look at that a little bit more when it comes to our comparison tool. Medical underwriting, we are going to talk about that more in depth, but there is some situations for medical underwriting. We're not going to talk about that just yet, but I will touch on it, I promise. And it doesn't matter if it's the same Medigap plan. It's going to vary in the cost because of those companies. So we have 3 main pricing based on age. So I'm going to go through these 3. The first one is a community-rated plan. A community-rated plan means regardless of your age, if you are 65 or older, let me clarify that, regardless of your age, 65 or older, no matter what, you all are paying the same exact premium, no matter ailment, no matter illness, whatever, condition. You are paying the exact same premium. Tennessee has one community-rated plan, and that is the POMCO plan, only eligible for Tennessee state retirees. Those are the only people allowed to purchase that POMCO plan. An issued age plan means that it's based on the age when you purchase, but it does not go up due to your age. So it's going to be more expensive in the short term and potentially, more expensive in the short term and less expensive in the long term. So if you're looking at the big picture, long term it might be cheaper. And then we only have about 3 to 5 companies that sell issued age plans in Tennessee. And the most popular one in Tennessee is the attained age plan, meaning it's based on your current age. It's lower when you're 65, but generally speaking, it goes up every single year due to your age. So it's cheaper in the short term, way more expensive in the long run. And that is the plan or the pricing that most Tennessee companies sell, is that attained age rated plan.
In Sydney, the community rated plans, I think the United Healthcare plans, the AARP plans, are pretty much community rated. and are available to everyone? They come up in our tool?
It's possible. I've seen United Healthcare come up as an issued age plan. I don't remember a community rated plan, but we can definitely look at that when we do the tool.
Well, like I've done some comparisons, and I've seen it. It's and what I have also seen, which is this is where it gets confusing, is that in the tool it may come up and say community rated, but when you go out and look on the chart on Medicare.gov, it'll say issue age or something else. That they aren't quite the same. So I'm not sure, but it does come up as community rated.
When you see those things, shoot me an email and let me know, and I can talk to the people that we contract with and make sure that they have it correct in the system.
Okay.
And what Nancy was just referring to, we are going to look at so you'll know what we're talking about. All right, so the best time to buy a Medigap policy. They call it the Medigap open enrollment period. I really don't like that terminology because when I say the words open enrollment period, what do you think of?
Yeah. Once a year, you can change it.
Part D.
Part D, exactly. Well, that is not the case with this. So do me a favor, when you hear open enrollment when it comes to supplemental plans, do not think of October 15th through December 7th. That has nothing to do with Medigap policy. So instead of calling it the Medigap open enrollment period, I'm going to call it the Medigap guaranteed issue period. And what that means is within the first 6 months that you have Medicare Part B as in boy on your red, white, and blue Medicare card, you can purchase a Medigap policy with no medical underwriting. Let me say that again. The first 6 months, you have Medicare Part B as in boy on your red, white, and blue Medicare card. You can purchase a Medigap policy with no medical underwriting. After that 6-month period, they can subject you to medical underwriting and deny you for pre-existing conditions. The first 6 months is the best time for Medicare beneficiaries who are thinking about enrolling into a Medicare Supplement or a Medigap policy to purchase one because they cannot look at your past medical history. However, that doesn't mean that that's the only time that you can purchase a plan. It's just the best time. Someone can apply for a Medigap policy any time of the year. You can do it whenever you want. But again, after that 6-month period, they're going to subject you to medical underwriting, and you might be denied coverage. Questions on that? Good, that means I explained it well. Excellent. All righty, so some people may delay their 6-month period. That's the best time to buy because they have other insurance. So my mom and dad right now, mom just retired on Monday. She's super excited. But mom and dad turned 65 last year. Mom is still working, so they have insurance through my mom's employer. They didn't enroll into Medicare Part B when they were 65 because they had credible insurance. Since they don't have Medicare Part B on their red, white, and blue card, their 6-month window hasn't started yet. So starting June 1st, after mom's insurance ends, that's when their 6-month best time is going to start. Does that make sense? Okay. I just now remembered that I'm being recorded, and I said I would never tell my mom and dad that I use them as examples. Sorry, Mom and Dad. All right. Okay. Pre-existing conditions, we've talked about this a little bit. They can look back and do what's called a pre-existing condition waiting period. So just because you have a pre-existing condition is not an automatic, oh, I shouldn't apply, I know I'm going to get denied. It depends on the insurance company. I had one gentleman who needed a knee replacement, and he didn't have a Medicare supplemental plan. So he applied, and what they did was they saw his medical records, because they're able to issue and look back at medical records, and see that he needed a knee replacement. Excuse me. So what the insurance company told him was, yes, we will accept you into the into the Medigap policy. However, for the first 6 months that you are in our policy, we are not going to cover your knee replacement or anything related to it because that's the pre-existing condition. So they had that 6-month pre-existing condition waiting period, but he was still enrolled into the coverage. They just didn't cover that pre-existing condition. So it is possible, if you have a pre-existing condition, that you could still be eligible for a Medigap policy. And there's actually a section in the comparison tool that we're going to look at here in a little bit that you can put in the medical underwriting and the diagnoses of your beneficiaries to see if there's a look-back period. So we'll look into that as well. Many of you may be thinking, the Affordable Care Act says that you cannot deny anyone due to pre-existing conditions. It was written into law. Well, the pre-existing condition clause of the Affordable Care Act only applies to essential health coverage. The Medicare Supplemental Plan only covers 20% of the health care coverage, which is not considered essential. It's not the majority of the health care. That's why this pre-existing condition clause is still eligible with a Medicare supplemental policy.
Hey, sweet, whoever you are.
Sweet Pea is next to you. I'm on the phone, Joanne.
I'm Joanne.
Yes.
How about if you waited 7 months? They would cover it then, right?
Yes. For my knee surgery, guys?
Mm-hmm. Yep.
Yeah, so it was just that first 6 months that he was enrolled into the coverage. Starting month 7, they will cover anything else related to that knee surgery. It's just that 6 months that they wouldn't.
For 6 months.
And there's some insurance companies that don't do the full 6 months. They may do 2, 3, 1. The maximum is 6 months, but you can go lower than that. Good question. So our next slide is for people with disabilities or end-stage renal disease. There are some states, and Tennessee used to be one of them, that if you were on Medicare due to a disability or end-stage renal disease, you were not allowed to be sold a supplemental plan. This was Tennessee prior to 2010. I believe it was 2010, if memory serves right. In 2010, Tennessee said that a plan or a company, an insurance company, if you sell any plan to someone over 65, you have to, by law, sell at least one plan to someone under 65. So let's put that in perspective. If you have an insurance company that sells all the Medicare plans, A, B, C, D, F, G, K, L, M, and N, to someone under 65, they only have to legally sell one plan to someone under 65. So they could choose, I'm just going to sell Plan A to someone under 65. They don't have to sell every plan that is available in their company to someone under 65. By law, they only have to provide coverage for one of the plans for someone under 65. Does that seem fair? Not necessarily. However, it is a step forward from where we were prior to 2010 when beneficiaries under 65 were not allowed to purchase anything at all.
And is that reflected in our tool?
I'm not 100% sure because our tool is not very useful for people under 65, and I'll show you why.
Yeah, I agree, and that's just why I'm saying, because you'll come up with almost pretty much all the plans bring something up for somebody under 65.
Yeah, our tool is catered mainly to people over 65, and it's not super useful for someone under 65. And when we get into the system, I'll show you exactly why. So that's a good question. Now, I always say, if you've ever been to one of my trainings where I'm the lead presenter, I always tell the group that 65 is a magic number. Whenever you hear Medicare, I want you to think of the number 65 because it is magical. It may not feel magical, but it is magical. Because when someone is under 65, they have another 6-month window of the best time to buy their Medicare supplemental plan when they turn 65. They get to do the process all over again. It's like they're reborn into Medicare, and they're a brand new Medicare beneficiary when they turn 65, because they are no longer on Medicare due to a disability. They are now on Medicare due to aging onto Medicare and turning that magic number of 65. Okay. Switching plans, we've talked about this a little bit already, so I won't stress too much on it. But here are some of the reasons that people want to switch their plan. You're paying for benefits you don't need. Maybe you bought a Plan F and you really only needed a Plan B. Or you need more benefits, like one of the clients that we talked about earlier. I got a Plan A, but maybe I really needed a Plan G or a Plan F because I'm still paying quite a bit out of pocket. You want to change your insurance company? I don't hear that complaint very often. Because the insurance companies are just paying the 20% and you really don't have to deal with them all that much. But the biggest reason people want to change their Medicare supplemental policy is to find a cheaper plan. Their plan has become extremely expensive and they want to find a lower premium. We talked about this earlier. Not a guarantee, but maybe a better way to consider changing your plan is to look in the same parent company that you're currently in and see what other supplemental plans that they sell. So stay within the insurance company you already are enrolled into. Could very well help, may not help, but it's worth asking. All right, next slide. When can you switch to a new plan? And this is talking about outside of that 6-month window when you first get Medicare Part B. They're called guaranteed issue periods, or guaranteed issue rights. And there's only 7 of them. And I think we only talk about 6 of them here in the presentation, but there are 7 scenarios to where you get a guaranteed issue right to switch to a new plan. Again, like we talked about before, if you can pass medical underwriting, you can enroll into a supplemental plan any time of the year. There's no dates that are restricting you that you have to enroll within a certain time. You can enroll whenever you want, whatever year you want, whatever month, if the insurance company is going to sell you a policy. So the guaranteed issue rights mean that the company has to sell you a policy. No ifs, ands, or buts. They cannot deny you a policy. They must cover all of your pre-existing conditions when the plan begins. They can't have any of those waiting periods. That has to begin when you enroll. They can't charge you more than someone your age when you enroll. And the beneficiary only has a 63 calendar day window to enroll. Now, when I say 63 calendar days, I'm getting some feedback. So if your phone's not on mute and maybe you're outside or in a car or you have quite a bit of noise around you, if you could put your phone on mute for me. Thank you. I think that helps a little bit. But you only have 63 calendar days, meaning that weekends are included. So it's not just work days or business days, Monday through Friday. They're also looking at Saturday and Sundays. So they have a 63 calendar day window. So when do you get these guaranteed issue rights? Well, we're going to talk about John. I don't think we have a John on the call. Do we? No. Darn. Well, if we had a John on the call, we're talking about John. He's in a Medicare Advantage plan. So he'll get a guaranteed issue right if he joins when he's first eligible at 65, and it's the first year that he's enrolled and wants to enroll into Medicare, original Medicare. So this happens, it's called a trial right period, and it's rather complicated to wrap your brain around. So if you don't understand it, when I first tell you, don't get frustrated, because it took me a little while to wrap my brain around it too. So let's say John is 65, June 1st of 2017. He's 65. He decides, I'm going to enroll into a Medicare Advantage plan starting June 1st, 2017. He has the first year that he is enrolled into that Advantage plan to test it out and have his trial right period, see if he likes it or not. Anytime within that first year, if he does not like it, he can drop his Advantage plan, go back on original Medicare, and have 63 calendar days to enroll into a supplemental plan with no medical underwriting. Okay? Again, if you don't understand it, don't get frustrated. I'm happy to explain it more to you, probably more on a one-on-one basis because we are running a little bit low on time. But that's what a trial right period is. If his plan leaves Medicare, so his Advantage plan no longer is in the Medicare system, he gets 63 days to pick up a supplemental plan. If his plan stops giving care in his area, meaning his plan pulls out of the county of residence that he has on file with Social Security, then he has 63 days to get a Medigap policy. Or the last one, if he moves out of the plan service area. I'm originally from Indiana, so if I decide to move home to Indiana, I get 63 calendar days to find a supplemental plan in Indiana. So those are 4 of the 7 scenarios.
The 63 days, is it as long as he files application with the plan within the 63 days, or does everything have to go through and be approved within 63 days?
As long as he has an application on file within that 63 days. As long as
the application is dated within the 63, okay.
Yes. All righty, Mary. We do have a Mary. No, we don't. Just kidding.
Sydney.
Sorry, Sarah. I'm sorry. I got to put the Mary in front of that. Oh, we have a close to a Mary. Anyway, so Mary has original Medicare. She'll have a guaranteed issue right if her employer group health plan or union coverage that pays after Medicare pays is ending. So she has employer insurance, but Medicare has to be primary, so this one's a little bit tricky because the plan has to pay after Medicare pays. That's a little more rare than what you'd think. And the other scenario is if she was enrolled into a Medicare Select policy and she moves out of her Medicare Select policy service area. I didn't cover Medicare Select policies in this presentation. The Medicare Select policy is like a Medicare Supplement and Medicare Advantage plan hybrid. A Medicare Select policy has a network of providers that you have to stay in. So it's saying what that guaranteed issue is saying is that she moves out of the plan's service area and out of the plan's network of providers. Then she would get a guaranteed issue right. So, again, I didn't cover that fully. If you have questions on that, I'm happy to address that probably outside of this webinar, just again because we're running a little short on time. All righty. So those are 6 of the 7. What's the 7th that really wasn't explained? The 7th guaranteed issue right is if the plan goes insolvent. Kind of goes along with leaving the Medicare system. It also includes insolvency or if the plan misled you into enrolling into the policy. So they didn't give you accurate information for you to make the best decision. That one's a little bit harder to prove, but it's possible if the beneficiary takes very detailed notes. All righty, we're close to being done before we get to do the tool, because I know everyone's excited about the tool. I'm excited about the tool. So we always talk about, with Medicare, there's a lot of terminology that you have to know. When it comes to supplemental plans, I really want everyone to learn the word suspend. Never, ever, ever say the word cancel. Always, always use the word suspend. Because if you suspend a plan, you have a chance to get it back. If you cancel a plan, that plan is gone forever, potentially. So I have 2 scenarios of where someone can suspend a Medigap policy. So this happens when a beneficiary has Medicare and Medicaid. Generally speaking, if a beneficiary has Medicare and Medicaid, they're not allowed to purchase a supplemental plan because the Medicaid is covering the 20%, the state is. So generally, we don't see this very often. It happens more when, let's say, my husband and I are married and we both have a Medigap policy. My husband passes away and my income drops, so now I'm on Medicaid because my income is so low that I now qualify. I still have my Medigap policy from when I was married and I had a higher income. So if that scenario happens, within 90 days of me getting notification that I am on Medicaid, I can suspend my Medigap policy for up to 2 years. Because you never know, a lot can happen in 2 years and I may lose my Medicaid. For example, I may get remarried within the 2 years of suspending my plan. If I get remarried and I lose my Medicaid, I have to inform my insurance company within 90 days that I've lost my Medicaid and I want my Medicare Supplemental plan back. And they cannot subject me to medical underwriting, and I have no waiting period. So you want to use that word suspend. Now, once that 2 years is up, it's no longer under suspension and it can go away. But it's important to know that you can suspend for 2 years. Okay? When you suspend the plan, you don't pay the premium, but that means that the Medigap policy is also not going to pay any benefits. So in Tennessee, we have some types of Medicaid that not all doctors accept. So if your doctor doesn't accept the Medicaid that you have and you're not paying your Medigap premium, you are going to be responsible for that 20%. So make sure the beneficiary sees doctors who accept the Medicaid plan that they are in. It says call your Medicaid office or Tennessee SHIP. Talk to your regional staff person, wherever you're at, your SHIP coordinator in the region. Don't call Medicaid. We can help do that for you. We have contacts that may be able to help a little bit faster than actually calling Medicaid. Another one is if you are under 65 and you had a supplemental plan and you or your spouse got employment and now have an employer plan. Same thing happens. Let's say I'm under 65, both myself and my husband are unemployed. A family member is helping me get a Medicare supplemental plan premium because I'm under 65. I'm probably not going to be able to afford it. But somehow I have a supplemental plan. My husband goes back to work. He gets an amazing job with health care. I can suspend my Medigap policy because he has employment, and within that 2-year suspension, if he gets laid off or something happens and he's no longer on employer insurance, I'm able to get that Medigap policy back with no medical underwriting and no waiting period. Again, you have to notify them 90 days before employment, or as you're notified you have employer coverage, and then notify within 90 days of that coverage being terminated in order to use that suspension. All righty. Yes, Linda.
I'm sorry, my sound went out, but I'm hearing you now.
Okay, great. So any questions? We're done talking about the Medigap. We're done with the slide portion. We are going to go and do a tutorial. Does anyone have any questions about anything that we've discussed before? No questions regarding the tool yet. As we go through the tool, we can get the tool questions. But any questions on a Medigap policy that we've talked about? All righty. Well, then what I'm going to do is I'm going to click the link, and we're going to go into the comparison tool. So all of you, if you are on the computer and you can use your PowerPoint, you can click the link inside the PowerPoint, or you can type it into your URL up here. Okay. So for those of you who do not have a username and a password, I'm going to show you how to get one. So what I want you to do, you click the link, and this is our home page. You know it's our home page because it has our logo. If it doesn't have our logo on it, you're not on the correct page. So don't try and request an account unless it has our logo on there. So if you don't have an account, I want you to click Request Account and fill out this very, very short form. So your first name, your last name, a phone number that you will answer. Sorry, just going to throw that out there. Also, your username is going to be your email. Make sure it's an email that you check. And then whatever password you want. There's no specific character or uppercase, lowercase number requirements. And then verify the same password. And what I really, really encourage you to do is put something along the lines of SHIP volunteer in the notes for requests. Because what happens is our director, Shannon Jones, she's the one who gets all of the user requests. And I'm the one who goes out and kind of knows all of your names. So if she doesn't see that it's a SHIP volunteer in there, she may deny you if I'm not in the office. Or she can't ask, hey, who is Sharon Hicks? And I'll say she's a SHIP volunteer and she'll approve Sharon's account. Sharon, she knows who you are, but you're just the example of the first name I saw. But that'll help her if I'm not in the office to make sure she approves your account. And then you would just hit submit, and it may take her a few days, but we will get your account approved. Again, very simple, really quick request form. So now I'm going to log in under my name. You can tell I've logged in under this computer before. And then we wait. There we go. And then you pull up your dashboard. Every single person, no matter if you're a SHIP director, regional staff, or a volunteer, everybody gets the exact same dashboard. I don't get any cool features that you don't get. So we're all looking at the same thing. This is what will show up on your screen. Welcome back, Sydney. Hey. That just takes your dashboard away. We're only looking at Medicare supplemental plans with this tool. We're not looking at drug plans, and we are not looking at Medicare Advantage plans. That's what we have the Medicare.gov plan finder for. So we're not looking at anything else through the system except for Medicare supplemental plans. So what I'm going to do is click this orange button of Run Quote. And we have some information to fill out. So first we need a zip code, and I'm going to use 37179 because I know that has multiple counties. And I lied. No, it doesn't. Darn it. Let me use my zip code. Sorry. So the zip code I'm using is 37076. You'll notice that it pulls up the county. It's important to know which county that beneficiary lives in. It could be a difference in cost if they're in Wilson County compared to Davidson County. So we're going to make sure that we uncheck Wilson County because I live in Davidson County. The age. This is where Nancy and I were talking back and forth that the plan is not the best comparison tool for someone under 65 because we can get all sorts of numbers. We can go up to age 99, but we can only go age 64 disabled or end-stage renal disease. So if we're talking to a beneficiary that's 45 years old, we're not going to be able to give them a very accurate estimate. So my strong encouragement and strong opinion to you all is only use this system to compare premiums for beneficiaries 65 or older. Someone under 65, we can give them sort of an estimate, but it's going to be very, very low estimate, and they're probably going to call the insurance company and get probably about double their estimate potentially. So I only use this system personally for people 65 or older. So we're going to use a 65-year-old who's going to be new to Medicare. And we'll start with female. We need to know if they use tobacco products or not. So I'm going to say non-tobacco or tobacco. And then we have our plans. So whatever plan, the first thing we do before we even open up this comparison tool is we show them that standardization chart. We show them the chart that has all the check marks and the 100%. So they know the coverage, and they can tell us what plans they want us to compare. So we're going to start with Plan F. We're going to sort by price. And our effective date we're going to have as June 1st. We're also able to apply household discounts, but I'm not going to apply those, and I'll show you why here in a minute. You can also put in a name of a client if you'd like, and then you're going to get quote. So pretty self-explanatory, pretty easy information that we need to gather. Nothing personal. We don't need their Medicare numbers. We don't need their birthdays necessarily. We just need their age. So this is a lot less invasive comparison than our prescription drug plans or our Medicare Advantage plan comparison. So here's our results. And if you notice up here at the top, it tells you the information that we've collected. So if we needed to change the gender or change the age or change the plan letter, we're able to do that without having to go back. Ooh, somebody's got a lot of coffee. So I heard in the background, just so you know. For Plan F for female 65, looks like the plan that is most cost-effective premium-wise in the short term would be Tennessee Rural Health Insurance Company at $110.87 a month. So let me show you a couple really cool things that we can do. So you'll see that there's a policy fee on some of them. There's also HH discounts on some of them. HH discount means a household discount. If a married couple, husband and wife, husband, wife, whatever, enroll into the same company in the same plan, they may be able to get a discount. So for the case of Bankers Fidelity Assurance Company, the married couple could get a 5% discount on their premium. And what we can do over on the side over here through Adjust View is we can apply those discounts and see if that changes anything. So if I click Apply Discount, Thrivent Financial for Lutherans actually comes up as the most cost-effective now because they had a 7% household discount. And our Tennessee Rural Health drops down to fourth most cost-effective. So something to consider if you're working with a married couple. Even if they're not on Medicare at the same time, I have a situation right now where the husband is turning 65, but the wife is only 60. So he's looking at the household discount saying, well, you know, it's very rare, but in 5 years, my premium is going to be lower rather than higher because I could get a household discount. So something to consider when you're talking to your beneficiaries. So I'm going to uncheck Apply Discount. You can see that the rates are listed on a monthly basis, so $110.87 a month. If the beneficiary wants to know what that is on an annual basis, you can click Annual Rate, and it'll show up how much it is per year. My experience, beneficiaries want to know the monthly cost and not the yearly cost. So I'll uncheck that. My absolute favorite feature of this system is called Market Analytics. So if I check Market Analytics over on the side, it's going to give us a 5-year projection of what their premium could potentially increase to. How cool is that? I get to tell the future. I love it. I feel like a psychic. So for Tennessee Rural Health Insurance Company, again, this is Plan F as in Frank. We're starting at $110.87. By the time this beneficiary is 69 years old, the premium could be up to $145.67 or 69 cents, an average increase of 7.1%. Something also to consider. If you look at the next most cost-effective plan, Bankers Fidelity Assurance Company, the plan is $116.53, so it's more expensive than what we talked about. But at age 69, the premium may only be $125.90, an average increase of 2%. So it's a little bit more expensive, but again, long-term, big picture, you might get cheaper premiums in the long run. And you can go down this list and do it for all insurance companies that sell a plan F as in Frank. Now also keep in mind, not every insurance company sells a plan F or a plan G or A or whatever plan the beneficiary is looking at. So if they say, I want to know what Blue Cross Blue Shield premium is for a plan N, and you can't find it, it's not that the system is wrong, it's that Blue Cross Blue Shield doesn't sell it. So don't panic if you don't see every insurance company on this list.
Sydney, scroll down and see if you can find United Healthcare. It's probably going to be in the $140 or $150 range.
Sure, no problem.
See if that says community.
Ooh, it is down here.
Yeah, it's more expensive.
Anybody else's eyes going? There you go.
There it goes. Stop. There you go. United Healthcare. Community rated. But I think if you go over to Medicare.gov to find their number, it's going to say issue age rated.
Yeah. So I'm making myself a note on that, Nancy. That way you don't have to send me an email. Check with GSG about healthcare. Excellent. Thank you very much.
Yep.
So again, we talked about those costs. You can see the rate type, attained age, community rated. Maybe you will find an issue age somewhere.
Look for Transamerica.
Oh, that's right. Transamerica.
Look for Cigna. Look for Cigna.
Cigna's not on there. You're not allowed to enroll in the Cigna. You know that.
But I have never seen Cigna on the supplemental plan list. They do the Advantage plans, but I've never seen them on the supplemental plan list.
I have one.
I'm not saying that. Again, I've not seen them come up in this list.
They can sell it in the state of Tennessee. It's underwritten by, I've forgotten, American something or other.
American State?
It's out of Texas.
Okay, but, they're probably under the parent name, because that's the other thing I've noticed here. What was it? Reserve National, and what's Reserve National? I think it's Kemper or something. But I couldn't match what I was seeing here with what's on Medicare.gov. I actually had to go out the internet to find a phone number for it.
Now that's another thing with this system is it is through a private company, so they tell us they look and update everything on a monthly basis as best they can. So they don't have phone numbers listed, which is one of the downfalls, another downfall of this system. But we do, in your big volunteer manual that you get every year, or if you got one of the thumb drives, you have a list of insurance companies that are allowed to sell supplemental plans in Tennessee. And if you don't have that, shoot me an email and I'm happy to send that to you as a separate attachment. Or actually, you know what? I'm going to add that to a follow-up email. Sorry, making myself a note. All right. I lost my train of thought, and I saw Alice had her hand up, so I'm going to go to Alice's question to see if it jogs my memory about what I was going to say.
All right, quick question, hopefully. So one of the things I noticed when using the tool, it doesn't necessarily say whether or not an agent is required to sell that or not. Or are we to assume if they're on here, the consumer can call the company direct and not have to go to the agent?
Yes. So we don't have to, with CHIP, we do not refer to agents. That kind of looks like a conflict of interest that, we don't want to refer to a specific agent. So what we do is we give them, Joyce Turtle, I can see you. Sorry. We give them the company name and phone number, and they call the company to enroll. CHIP staff and volunteers cannot enroll someone into a supplemental plan. We don't have any of that capability. So you have to call the plan.
I'm sorry. I had one client that I was helping, and when I was helping him walk through, when we got the insurance company on the line, I'm not sure if I found that one in the tool. When we got the insurance company on the line, they wouldn't talk to us. They said he had to go through an agent, so we just found another company.
Yeah, I mean, the insurance company should have, okay, well, I'm going to transfer you to an agent who can enroll you. So it's kind of, that's a little weird.
Well, we didn't want an agent because that was what was his problem between the commission and print. It was just high. We found one that he could get without going through an agent, and it was much cheaper.
Excellent. Okay, real quick before I answer any other questions, and I promise I will get to more questions, but I want to show you one other thing about this tool. Is we talked about pre-existing conditions. So if you look over on the side below where market analytics is, you can apply health questions and you can add some conditions. Excuse me. So let's add, for example, heart attack. And if you check mark heart attack, for Tennessee Rural Health Insurance Company, for example, they look back 5 years to see if you've had a heart attack. If you've had a heart attack within the last 5 years and you're outside of that guaranteed issue right period, and you've had a heart attack, you're most likely going to be denied coverage for that heart attack. And you can see there's all sorts of, I like to look at diabetes dependent on insulin. Depending on insulin, 5-year look back as well. Info not available, so that's something that they are going to have to look at, and what they call that insurance company. 2 years on the heart attack, 5 years on diabetes dependent on insulin. So you can go through and look at all those medical underwriting situations as well. Now, one last thing.
Sydney, what does that mean, 5 years?
5 years means that they can look back at your medical records and say, within the last 5 years, you've had a heart attack. So
I got that. I mean, I'm talking about diabetes.
If that diagnosis shows up in your medical record within the last 5 years, then it will be considered a pre-existing condition. Now, whether or not waiting period or anything is applied, that's different. But if that diagnosis shows up in your medical records, then that's going to be a part of the underwriting.
Yeah, okay. Thank you.
All right, I don't know. All right, I have to move Nancy down here. Okay. The last thing I want to show before I open it up for questions, because I know it's 11:30 and I really want to respect everybody's time. So if you have to drop off of the webinar, I completely understand. I apologize for going over. Those of you who know me know I talk a lot, so you can kind of just anticipate it, let's be honest. But you can also change your plan level. So let's go with Plan G instead of Plan F. Same exact spectrum of all the different things that you can do apply. The only thing that's going to happen is we're going to change to Plan G, and your premium goes down to $90.05. Same market analytics, and you can add your medical underwriting as well. So I'm going to open everything up for questions. Again, if you have to drop off the webinar, I so appreciate everyone taking the time out to come and listen to the webinar and learn more about Medicare supplemental plans and get this update training. So if you have to drop off, I understand. If you want to stay on and ask more questions, I'm going to open up the floor for questions now.
This is Nancy. I don't want to make a question. It's just something that you haven't mentioned that they might be interested in, and that's the compare quotes. That if you click on the name of an insurance company, it'll change it to green. You can put in up to 5 of them and then click the compare quote, and you can bring it up as a PDF, which you can either then print or save or send. I'm sending them out to people all the time, so that because for people, if with me, I'm on the phone with them. At least for me, I couldn't keep all of this straight if somebody was just giving me all this information over the phone. This way you can have something to send to them so they will have it in their hands to look at and can ask whatever questions they want to ask. That's all.
Absolutely. I agree with Nancy on that. I actually don't print off comparisons that way. I print off like it is right now so they can see the projection of how much it would be with their age increase. And that goes away when you use the compare quotes tool. So you can print it off either way. Any other questions or comments?
Yeah, this Thrivent Financial for Lutherans, would you have to be a Lutheran in order to get that?
It is possible that they have specific requirements. Or it could be that you just pay the $25 policy fee and you're good to go. I haven't had any clients apply for Thrivent Financial for Lutherans, so I haven't gotten any feedback on that.
I have, and I don't think you have to be a Lutheran. One other one that comes up frequently that I've called and asked the question is USAA, because they're for vets, and I'm thinking, okay, so can anybody get it? And that policy, the USSA policy, is available nationwide to everybody. It's not only for veterans. Anybody can purchase it from USAA.
Oh, very cool. I like that. Any other questions? Yes.
Yes, Sydney.
Mm-hmm.
Sydney, this is Sharon. Okay,
go ahead, Sharon.
It's a supplement related question. This has happened to my parents. They actually live in Georgia, but my dad has it, so it's automatic. He and my mom, their payment is automatically sent from the bank every month. So if they're in the hospital or whatever, it's always sent. What's happened to them is, and he has been disenrolled twice for non-payment because they keep changing the address where the payment goes. Now, he's been able to get back on because he's been able to prove that he paid it every month. But are you seeing this? This is just bizarre.
I have not had a client in that situation, and it could be that it's in a Georgia plan. Is it a plan that's specific to Georgia, like Tennessee Rural Health Company?
No, it's Blue Cross Blue Shield F plan.
Oh.
Have them call the state. Have them call the state insurance commissioner and talk to them about it.
Yeah, it's okay. He has been able to get back on, but I was just curious if that was something that people had been seeing.
Another way to get around that he may not be comfortable with, because I'm not comfortable with it in my personal bills, but doing a bank draft. That way he doesn't have to mail a check to an actual location. It comes automatically out of the bank account. Could be another way.
And I
to
suggested that to him. He's kind of a control freak. But I said, you do not, because I've told him, no matter what happens, don't you ever not pay that bill. So, but that's a good idea. I may get him to do that.
Another option, if the plan has it available, if they'll allow it to be charged to a credit card, and then he just pays the credit card.
Right. Yeah, he's got to do something, because this is, the older he gets, it's going to be, he may not be able to figure it out. So, all right.
But I'd say again that to me, because if it's happening to him, it's happening to others. So
well, that's what I thought. And
I
was
would talk to
wondering,
the state insurance commissioner.
And on the Medicare website, it doesn't have as the rating's not as high as it used to be. That was kind of like the gold standard in Georgia. Get the Blue Cross Blue Shield Medigap plan. But I noticed the last time I was on the Medicare website they didn't have as high a rating, so that may be why.
Very possible. All right, any other questions from anybody?
Hello, Sydney.
Yes.
This is Laura.
What's up, Laura?
Hi. I'm asking on here, when you change the plan from F to G, then the age started at 66. Does that have to do with that the age starts, you have to be 66, or that's the projection side, or that's just showing when the age starts, it starts increasing. Okay, I see now. Okay.
Yeah, the $90.05 is at age 65, and then it goes down the next year.
Okay, thank you. I see now. Okay.
Not a problem. Good question. Because I guarantee you weren't the only one who was thinking that, because when I first started, I'm like, this doesn't make any sense.
Okay.
Anybody else have any questions? All right. Well, in that case, I'm going to stop the recording.